Well, good morning, everybody. It's great to see everybody here, and there are a lot of very familiar faces and friends in the audience and a lot of colleagues from Queensland Health, so a very warm welcome. For many of you who I've already talked to since coming into this role, you would know that I promised this pit briefing back in January this year. Unfortunately, of course, there was an election called, and I found myself trying to understand what caretaker mode actually means in government, and yes, it was a quick awakening. So I apologise that it's taken us this long to come back and have a chat to you, and understand that the last time there was a pit briefing by Queensland Health, it was from the former Director General, around about June, July, I think that might have been. So it's a long time between drinks, and thank you for your patience. What I'd like to take you through today is just an update on what the former DG talked to you about in terms of a new way forward for the delivery of ICT services within Queensland Health, and what was a fundamental change in approach with the separation out of the strategic function from the operational function. I'll just recap on that in a moment. So the structure of that is pretty much that we have both Colin's and my portfolios working hand in hand to deliver strategy and technology to the Queensland Health ecosystem, which is a fairly broad ecosystem, 16 hospital and health services, 90,000 staff. I won't talk about how many XP desktops we have, but Colin might do that. And you know, we are a complex organisation, and for the vendor community, for this industry, it is really difficult, I know, for you to understand what's the best pathway into that very complex ecosystem. So, you know, we need to work on that, and we're working with the city to come up with better solutions for how we can engage industry and how industry can engage us. So that ecosystem that's on that slide also talks to the fact that not just the HHSs, but there are a number of clinical services the department provides outside of those, and that includes ambulance services. So just on that IT structure and the difference between Colin's and my portfolio. So my portfolio sits within the department. Colin's portfolio is a separate agency, HSIA, as you've all grown to love over the number of years. Colin's smiling, that's good. So the Office of the Chief Health Information Officer is about strategy, architecture, standards, policy. And the Department of Health, you know, if you think about the fact that since 2012, 1st of July 2012, when the Hospital and Health Boards Act came into existence, so for 3 years we've had hospital and health services as statutory bodies undertaking the frontline delivery of healthcare. And the Department of Health, as the system manager under the Act, really trying to understand what its role should be. It's very important that the Department of Health continues to refine its role in the delivery of healthcare in Queensland, and it needs to be much more strategic. It must deliver much stronger policy in terms of how healthcare needs to operate as an ecosystem within the state. And IT is part of that leadership. And the reason why the Office of the CHIO was established was to provide that leadership to the health system, and with Colin's assistance to execute on that vision. And I'm going to share a little bit of that vision with you. So my portfolio, my structure has these 4 peers. I'm not going to go through them in detail. You'll have access to this pack, is my understanding. So, and I've shared with a number of you this information previously, so I'm not going to go through it in detail. But what I do want to talk about is this paradigm shift, which needs to be, and I was at an AIIA function earlier this week, and I talked about authenticity. You know, the need for authenticity in the way in which governments interacts with industry and with other partners, you know, not just the IT industry, is critical to our success moving forward. So it's important that, from my perspective, that we're supporting innovation. And innovation happens in this state every day, and government, you know, we want to embrace that innovation. Sometimes we struggle to do that. I think that's a fair thing to say. So it's important that we support healthcare innovation through this strategic alignment of ICT, and that we establish information as a strategic asset. In healthcare, that doesn't generally happen. information tends to be seen as a byproduct of the delivery of healthcare, not seen as a strategic asset. So we want to turn that around. We also want to establish enduring partnerships, both internal and external. And my role and Colin's role is very much about service provision. It's about, in my case, best practice advisory that I keep harping on to my team about, and Colin, he wants best practice service delivery. So we need to, the only way we can really do that is to establish effective relationships, both with our customers and with our suppliers and with other industry partners. And the only way we're going to get to that bottom slide of being a centre of excellence is through those relationships. So this paradigm shift, actually means moving from where we were to something new. And what we don't want to have is what's in that cartoon there, which is a direction just to keep doing what we've been doing, but wrap it in a new shiny bauble. So it's very much about, if we look at the old approach, which was that there was little stakeholder involvement in how we prioritised IT. There was little customer engagement. The decision making was very department centric, and the major programs were delivered without really clearly defined benefits and without a business owner that was the true champion of that investment. So moving forward, what we're moving to is this concept of co-design, and that co-design happens both internally and externally. And I'm very excited to be able to announce our first co-design procurement with you today, which I'll take you through in a moment. But it's really important that we're, again, use that word authentic in the way in which we're engaging with both our internal customers and stakeholders, and there are a number of external stakeholders as well when you think about the Commonwealth, but also, with industry. And we need to give you the opportunity to shine, and sometimes we don't do that. So the other thing is that in terms of governance, and we won't mention the Queensland Health payroll other than that brief statement I just made then, is that governance is critical. So the efficacy of our investments and our ability to deliver benefits from those investments means that we need strong governance. And that new governance framework, which has now been endorsed, will see a number of controls built out to ensure that we don't have that same outcome of that thing that I won't mention again. The other thing that's important is that the programs that we deploy have to be done in collaboration and driven by the hospital and health services or our customers. We can't do them centrally anymore. And that's a big shift in culture and a big shift in approach for this department. And I know both Colin and I are very committed to seeing that happen. So I just wanted to share with you, and a number of you have already seen this. This is in draft at the moment. It's very close to final approvals and sign-offs. There are many hoops you have to go through within government for these sorts of things. And this is about establishing an e-health architecture vision for Queensland, which goes broader than just the Department of Health, because it takes into account all the ecosystem partners that we need to work with to deliver quality healthcare in this state. And I'm not going to go through it in detail. You'll get it in the pack. And actually in the tender documents that I'm going to announce shortly, there is the full document that sits behind this that I'm very pleased to be able to share with industry today. But it's all about establishing these e-health enablers, these technological enablers that allow the department to start thinking about new models of care. And I know many of you have ideas for how we can actually transform healthcare delivery. But until we have these basic enablers in place, until there is trust by the system in IT's ability to be a partner, then it's very hard for clinicians to look at IT and say, will you be truly transformative, or are you just going to be another stumbling block? So once we have those enablers in place, and that is going to be our focus, then we can have meaningful conversations with clinicians about new models of patient-centred care that will allow, for example, things like the medical home, that will allow us to look at better models for utilisation of telehealth services. So once we have that capability, then we start working up that stack in terms of our integrated EMR trajectory, which is ongoing in parallel, what we might do with other integrated clinical systems around best and multi-breed. And then we start building out this knowledge hub that then the whole ecosystem can share. So a key part, if I just go back actually, if you look at the bottom of that slide, and if you can see my mouse pointer maybe, no, okay, I can't see it. Down the bottom in the middle there under the interoperability stack is the messaging and integration engine and web services catalogue. That is a fundamental component of our ability to move beyond our legacy environment today to what will be a world-class IT infrastructure and information architecture moving forward. So this interoperability vision is about an enterprise service bus that will enable all ecosystem partners, including both internal and external, to actually participate in this system of healthcare in Queensland. And the announcement I have today is that we're releasing the interoperability, integration interoperability request for solution to industry. It will be available on QTender today by close of business. Fingers crossed, we're all good. So, but the way we're doing it is different. And I want to talk about this co-design procurement methodology. So in the past, you would know that the way government tenders tend to operate, and I hope I'm not being too critical, is that we spend an awful lot of time building up a functional requirements specification. And we are quite proud of the fact that we develop a 2,000-page specification with the most exquisite detail of what we're asking you to respond to. And usually you have a choice. Yes, we do that, we could do that, or no, we don't do it. And you're then judged on your responses to that. And ultimately what that means is we get exactly what we ask for, but we don't always know what we want. So the other problem with that procurement methodology is we invest an enormous amount in that process, you invest an enormous amount in responding to that process, and then the procurement cycle is probably something of the order of 2 to 3 years. And by the time we actually do something, the world's moved on. We've changed our requirements. So we're doing something different, and we're going to do something different that's meaningful. It's meaningful to you as an industry because it allows you to innovate. It allows you to share with us what you think what outcome you think you could deliver for us, not what outcome we tell you to deliver for us. And it also is important for us because it means we get the best possible outcome. So this procurement methodology means that instead of that 2,000-page detailed specification, we just tell you what our problem is and we give you an indication of what we think our target capability or our target state is. And then we let you tell us how to get from A to B. And I think that's a very different way of doing it. Now, we're not going to do it for every procurement. That doesn't make sense. But for the really strategic procurements, this has to be the model moving forward. This is the first for us as a department. I'm not sure at a whole of government level, but certainly it's a model that we're going to put every effort in to make sure that it's successful because it is an important model for Queensland in terms of that agility of procurement and the ability to deliver the best possible outcomes. So this, the way it effectively works, I kind of went through that today, is that what we're seeking is an industry partner to take us to the next step. So we're chunking it down. We're using, to some extent, paralleling the gating process around governance, but we're just choosing a partner to go to that next phase of an implementation planning study. And then, that still allows you to participate in the next phase if that's appropriate. But what it also does, it means that there's an opportunity for collaboration within industry. So you may be the solution, the actual technology solution provider. You might be a systems integrator. You might have part of the solution, but you can come together and say, if we come together in this way, we actually deliver a better outcome for you. So I'm very happy to be able to announce this request for solution. We call it a request for solution instead of anything else. That was the best we could come up with. And I was going to make a joke that we got it down to 1,400 pages, but I thought, no, that's probably a bit trite. So what we have is there's 4 parts to this tender, and I've got it here. There are some other appendices which talk to our current state environment, that talk to that e-health architecture vision document. So there is some supplemental pieces of information, our current list of interfaces, etc. But the core to this request for solution is in 4 parts. The first part, which is that big, it just introduces this process to you. So why we're going down this path. The second part is the terms and conditions of your response. So you can see it's a very thick document. The third part is the guts of it. That's the current state, target state specification. It's all of 10 pages. Okay, so you can read it on the taxi going back to your offices. And the fourth part is how we want you to respond. Again, a really thick document. So, you know, hopefully an innovation, perhaps, in the way in which we're doing procurement, but are really important that we get this model right. And we want your feedback on the process as much as we want you to participate in this, because we need to get this process right. We can't afford 2 to 3 year procurement cycles. We can't afford the industry to be spending $500,000 to $1 million to respond to these things. It's just not in anybody's interest. So,
the rest of the document is this thing.
Thank you, Stephen. So the appendices, you know, are 1,400 pages. So we've got some dates up there for you, where, as I said, this is the most important procurement that we will do in regards to our information infrastructure. This interoperability and integration engine will release our potential as a health service provider to be able to interoperate across the ecosystem of healthcare in Queensland. So it's critical for us. So I've got the dates there. This is all available in the information pack. These documents will be, or already are, will be on Q-Tender today, this afternoon. So very exciting to be able to release this to you, and I'm sure you'll have questions in the Q&A panel. How am I going time-wise for my timekeeper? On track? That's excellent, because I now get to hand over to Colin. Thank you.